Hey, Dr. Shakib here from Irvine Spine and Wellness Center, your Irvine Chiropractic, Posture and Movement Clinic. This video is about layered syndrome, what layered syndrome is, and how to get rid of it. So stay tuned. Chances are, if you're watching this video and you're familiar with the term layered syndrome, you are already having a lot of movement issues, a lot of aches and pains here and there. Layered syndrome is really not more in men than women or vice versa. It's not really for older people. There are a lot of younger people who have it. And what layered syndrome is, another name for it is upper and lower cross syndrome. So in general, it's not just the upper part or the lower part, it's the whole body when it comes to movement having issues. Layered syndrome typically is as a result of one major injury, typically years ago, that was not really treated properly. Treated properly does not mean it got ignored, doesn't mean your physical therapist or if you saw a chiropractor, your chiropractor was not competent. That just means that only the site of problem was addressed, the area of complaint was addressed, not only not for long enough time, but it was addressed more in isolation. So imagine if movement is like a concert, and the concert's not sounding right, but you hear the pianist really not doing up to par job, and you go after the pianist and try to fix the pianist's role in the concert and somehow expect the concert to do well. And then you go back and it's like, still doesn't sound right. So typically what ends up happening is you injure an area, and then you go isolated. You, let's say, do physical therapy exercises about it on that specific region. And then the connection and the role of that area in overall movement, the neurological pathway for movement is compromised as a result of that injury, long-term injury perhaps. And then the neurology was not brought back. So the neurology that I'm referring to is not a nerve pain. I'm talking about a command from the brain to the body part. So it's one, in order for movement to happen, the command has to come from up here. So imagine you going home is just whatever path you take, and the road is under construction, so you keep going through the detour, and now the construction is done, but you still go through the detour. So when you have to modify, and this automatically happens without you making that decision, the neural pathway to get a job done when it comes to movement due to whatever injury, when the area is rehabbed properly, not in just that region, then that neurology has to go back to the design of neurology that you're born with. I'm really talking about a lot of things here that may distract you, but hopefully it brings some degree of awareness so you can look up these things. What I'm referring to is postural neurology, functional movement. If you go to the description box, you'll see some resources for you on my website that you should definitely look into. Going back to layered syndrome, what ends up happening as a regional issue, and so weakness and tightness in certain parts in your upper portion, as an example, just that lack of proper movement and coordination. And we're not talking about you acting like you're drunk. We're talking about the progression of movement, the sequence of muscle engagement and muscle letting go. It's that flow in movement which you don't think about, just like you don't think about your blinking. It is innate in you. So when there is a tweak in that as a result of an injury, or let's say lifestyle, or a combination of both, and then that goes beyond the region and crosses over to the opposite end of you. So if it's upper, you may start with upper going to lower cross, or lower area going up to upper cross syndrome. The combination of those two is what's referred to as layered syndrome. The proper treatment is not to address the region, it's to address everything in movement, just like that concert example I gave you. It's more detailed, but what other choice do you have? You gotta put your head down and go through. The key in proper treatment is who you seek care from. We all have great intentions as providers. Pretty much we all do. We all want to see our patients get better, but I think it could be a lack of understanding the bigger picture in that specific regional issue that patients come in that make a treatment more effective or not. To understand more about postural neurology, functional movement, which is the right answer to not only layered syndrome, but a lot more other issues, a lot more chronic issues for sure, I invite you to visit my website so you can better understand it. And also, I really don't mind if you ask a question either in the comment section here or use my email and email me. Either way, I'm okay. The purpose of doing these videos is for you to better understand how to treat yourself so you can enjoy life the way you should. If you have not subscribed to my channel, this is your opportunity to do so. And I hope by now you understand more about layered syndrome, what causes it, and how to effectively treat layered syndrome. Until next time, take care.